In this lecture, we are going to discuss transmission and the pathogenesis of the hepatitis B virus. So let's get started. First of all, we will see how hepatitis B virus transmits from one person to another. So most important component will be the blood. Okay, here is the most important component. So during the transfusion of the blood from the donor to the recipient, you will see the transmission of the hepatitis B virus. So it is advisable for you to go for the screening before the transfusion of the blood. Another most important component will be the barber shop. If the barber is using the same razor for all the people, then you will see the transmission of the hepatitis B virus in that case. So it is advisable for you to take your own razor whenever you go for barber shop for hair cutting. Okay. Next, you will see the sexual intercourse. Okay. Next component is the sexual intercourse. So during the intercourse, we will also see the transmission of the hepatitis B virus from one partner to another. But why? Because the hepatitis B virus is actually present in the semen and the vaginal fluid. Okay, so that is the important thing. Hepatitis B virus is actually present in the semen and the vaginal fluid. So that's why during the intercourse, you will see the exchange of the fluid between the partners, and it will be the cause of transmission of the hepatitis B virus between the partners. Okay. Another important thing, why hepatitis B transmission is most important related to the intercourse. As we know that the hepatitis B virus is actually an enveloped virus. So enveloped virus requires more favorable condition as compared to the non-enveloped viruses. So condition will be provided during the intercourse, like the normal temperature and the wet condition. So these are the condition that is actually provided by the intercourse to the hepatitis B virus. So that's why hepatitis B virus survive during the intercourse and transmit from one partner to another in that case. Another important thing, as we see that the hepatitis B virus is actually present in the vaginal fluid. So whenever a female gets pregnant and during the time of the delivery, you will see the pass of the baby from the vagina. Okay. So during the delivery, you will see the transmission of the hepatitis B virus from mother to the children as well. Again, that is the most important thing which you have to remember. And next component you will see during the pregnancy. During the pregnancy, you will see the transmission of the hepatitis B virus from mother to the newborn, and that is actually the transplacental transmission of the hepatitis B virus, but it's a rare case. Okay. And next you will see for the healthcare professionals, and that will be the needle stick injury. In that case, you will see the needle stick injury for the healthcare professionals. That is again the most important component. And the transmission of the hepatitis B virus also common in the intravenous drug user. So here are basically the different components of the transmission of the hepatitis B virus. If we look at the pathogenesis, so first of all, the hepatitis B virus affects the liver. Okay, here is the liver, and liver is actually made up of hepatocytes. Okay, liver cells. So if you see here, here is the hepatitis B virus, and that virus is actually enveloped virus in that case. Okay, that is the important thing. So hepatitis B virus has receptor on the hepatocytes, and it will attack on the hepatocytes. Okay. So first of all, hepatitis B virus attack on the liver. Okay. After that, you will see the presentation of the antigen on the surface of the hepatocytes. You will see the lot of antigen presentation on the surface of the hepatocytes. Now, these antigens will be detected by our immune system. Our immune system will detect the antigen and will destroy the hepatocyte as a whole. And the most important component of our immune system that actually do this task will be the cytotoxic T cell. Cytotoxic T cell will perform this function. And after that, you will see the inflammation and the necrosis of the hepatocytes. But don't worry about it. Hepatocytes have ability to regenerate themselves. And after that, you will see the regeneration of the liver as well. Okay. Next, if you see the chronic carriers, what does it mean by chronic carrier? So basically, whenever you see the presentations of the hepatitis B virus or the hepatitis B surface antigen in the blood for 6 or more than 6 months, then you will declare it as a chronic carrier. So most important thing, hepatitis B virus or hepatitis B surface antigen for 6 or greater than 6 months. That is the chronic carrier state. So in the chronic carrier, you will see the presence of the viral DNA into the hepatocytes. So if you see here, here is the hepatocytes, just one cell of the liver. So inside the hepatocyte, you will see the presence of the nucleus. And viral DNA is actually present in the nucleus. And it can be present in two forms. Viral DNA can present as it is, as an intact form, that is called the episomes. And other form, hepatitis B viral DNA can integrate with the DNA of the hepatocytes. There is another form. Okay. And in that case, you will see the productions of the proteins. These are the HBX proteins. Now, these HBX protein will produce by the viral DNA. And after that, this HBX protein will inactivate the P53 tumor suppressor proteins that actually suppress the tumor. Okay, here is the P53 tumor suppressor protein. Whenever you will see the inactivations of the P53 by the HBX, then you will see the hepatocellular carcinoma in that case. So it means that chronic carrier states promotes the hepatocellular carcinoma, and that is actually the HCC. Another important thing you will see, as the hepatocytes destroyed by the immune cells, and ultimately you will see the regeneration of the hepatocytes. Continuous regeneration can also go towards the hepatocellular carcinoma. That is, and again, the most important thing, regeneration. And third most important component you will see, as you see the integrations of the viral DNA with the cellular DNA. Now, these insertional mutations can also go towards the hepatocellular carcinoma due to the insertional mutation in that case. So, insertional mutation can also go towards the hepatocellular carcinoma in that case. So, there are basically the different conditions that are actually related to the chronic carrier state, and ultimately the patient can go towards the hepatocellular carcinoma in that case. But the chances of the chronic carrier in adult will be the 5%, but in newborn it will be the 90%. That is again the most important thing. In the adult, you will see the presence of the chronic state will be the 5% only, but in the newborn you will see the chances of the chronic carrier will be the 90%. But why? Due to the cytotoxic T cells. Cytotoxic T cells are not perform its function properly in the newborn as compared to the adult. So that's why the chances of the conversion of the infection towards the chronic carrier state in the newborn as compared to the adult. And ultimately, after that, you will see the carrier state will go towards the hepatocellular carcinoma. That is the most probable state in that case. And After the infections of the hepatitis B virus, it will give the lifelong immunity against that virus. Again, that is the most important thing. By the productions of the hepatitis B surface antibodies, actually you will see the presence of the hepatitis B surface antigen, and against this antigen you will see the production of the hepatitis B surface antibody in that case. So these antibodies will neutralize or will reduce the infectivity of the hepatitis B surface antigen, but not the core antibodies, because core antigen is present inside and the core antibody can't do anything on it. But the hepatitis B surface antigen can do. So this is all about the transmission and the pathogenesis of the hepatitis B virus. If you still have any question, you may ask in the comment section. Thank you so much.